Hey, Nurse Cat here with NCLEX Mastery. We're going to do a little Galentine's NCLEX. Don't forget, comment, download in the chat if you want to get access to the #1 NCLEX test prep app in the App Store. Let's get into it. All right. A 45-year-old female is counseled about the risk of myocardial infarction. Which recommendations does the nurse include? Integrate moderate intensity activities most or all days of the week. Stay alert for changes like fatigue, nausea, chest or jaw discomfort. Increase protein and calcium in your daily food intake. Discuss hormonal therapy use with providers on your care team. Check your blood pressure and heart rate once each month. One thing to take note of, the question stem is not going to tell you someone's age or sex unless it matters to the question. So as you look at these choices, you need to keep that in mind. Drop your answers in the chat. All right. Moderate intensity activities most or all days of the week. So the full recommendation is 150 minutes. That sounds like a lot, and that's a terrible way to get somebody interested in exercising a little more. So if you tell them that most or all days of the week that they should be doing a little bit of moderate intensity activity, you're going to get a little bit more participation. Almost every learner gets this one right. Stay alert for changes like fatigue, nausea, or chest and jaw discomfort. So we know our atypical symptoms in women. I mean, there's even a story floating around out there, urban legend, that somebody came in with a big toe pain and it ended up being a heart attack. So women do it different, right? Increase protein and calcium in your daily food intake. You don't have any reason to make a suggestion like this. I mean, think about that. You didn't give them any recommendations that they can latch onto. Increase it. Okay. Every meal? Occasional meals? Supplements? What do you want me to do? The other thing is there's actually not any evidence that increasing those two things actually prevents heart attacks. So you're just making stuff up. Discuss hormonal therapy use with providers on your care team. So this is actually the most oftenly missed but correct response. Remember, we said that age and sex wouldn't be in the question unless it mattered. It matters. Hormones are a huge component of women's heart health and heart risk. So whether it's birth control pills or hormone replacement therapy or menopause and the absence of hormones, this matters. And check your blood pressure and heart rate once each month. So that last one is just an incomplete recommendation and isn't based on anything, okay? So you could tell her to check her blood pressure and pulse once a day, once a week, once a month. You're still wrong because she didn't have any presenting risk factors in the stem other than age and sex. So without any other issues, her annual checkup's going to be just fine. Now, go out there and make sure